Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health of the region of Peel, Tim Beckett, our Fire Chief and our Director of Emergency Management, and Sean McKenna, Staff Superintendent, Peel Regional Police. This week didn't get off to a great start. We saw a record-breaking 700 new cases across the province. Earlier today, the province released its latest modelling numbers, projecting that Ontario could see more than 1,000 new cases per day by the first half of October. The GTA continues to be the most impacted, accounting for roughly 3/4 of all cases. This is concerning. We're keeping an eye on what is happening in our neighbouring cities like Toronto, and we're acutely aware of our proximity and the impact that any changes in Toronto or Brampton might have here in Mississauga. In Peel, however, we're currently averaging 75 to 100 cases per day, and 28 on average in Mississauga over the last week. While these numbers are much higher than those we saw this summer, our averages have been holding relatively steady for the past month, meaning that we're not seeing a massive surge in cases right now. This means we are not yet experiencing a second wave here in Peel, but we know this can change at any moment. It also means we must take every effort to stop it, or at the very least, reduce the severity. My message to residents and businesses is clear. We need to work together to keep each other safe and to reduce a second wave so that we can keep our city and our economy running. There's no denying that over the summer, people became excited that life was getting back to normal, the new normal, and everyone got a little bit lax when it came to COVID-19 prevention. There was a lot of hugging and touching, not keeping a proper social distance, and not wearing a mask in settings where people really should have been. This very behavior paved the way for the virus to move into our community. I know Dr. Lowe will speak more about this in a few moments, but in Mississauga and in Peel, our pandemic picture has been driven in some part by cases emerging from social settings. In the past week, we have seen cases linked to weddings and social functions at banquet halls, small get-togethers with family and friends, and at places of worship. I believe further measures can be taken, particularly in banquet halls, and I spoke to the Premier about that this morning. I know Dr. Lowe also continues to communicate recommendations to the province on what more can be done to stop transmission in social settings. We, of course, want people to avoid large gatherings and keep it small. That's 25 people outside and 10 people inside in private residences. It's important to remember that COVID doesn't discriminate. It is up to us to stop the spread. If you're not taking steps to reduce your risk, no matter the setting you are in, that means staying apart, lathering up, and masking up. You are putting yourself and others at risk. Period. Full stop. As we work to reduce the severity of a second wave, it is time to consider shrinking your bubbles to the most essential people in your lives. Whether that is the people you live with or work with, keep it as small as humanly possible. Reassess your social calendars. Are drinks and dinner with friends this weekend or Friday night really necessary right now? Can it move to online, or can it wait? Ultimately, it is up to each of us and every one of us to make the right choices in the weeks and months to come. Only we can move this virus, and only we can stop it. The good news is that the message is clearly getting across about the need to limit large social gatherings. Our 311 call center only received 29 complaints last weekend about large parties and gatherings, resulting in only one ticket being issued to the promoters of a drive-in concert. We have also seen near perfect compliance, 99%, when following up with a variety of businesses on our face coverings and restaurants and bar bylaws, resulting in only 7 tickets being issued over the past week. I want to thank our business community for working to keep their customers safe and to keep COVID out of our bars, restaurants, lounges, and retail stores. This helps reduce pressure on our hospitals in terms of testing and treating patients, and also on our public healthcare staff who continue to work around the clock to track, trace, and break the chain of transmission. If you need to be tested because you've been exposed and have symptoms, please go to Credit Valley or the Mississauga Hospital Assessment Centres. If you don't have any symptoms, you're asymptomatic, but live or work in a high-risk setting or plan to visit a long-term care home or have been in contact with a confirmed case, please visit one of the 8 pharmacies across our city who are offering asymptomatic testing. Right now, each of the 8 pharmacies are processing roughly 50 tests per day by appointment. I urge the province to either expand the number of pharmacies offering this program and ensure that they have the capacity to conduct more testing. There are communities in our city that were not captured in the initial rollout of the pharmacy testing program and where the need for more testing exists now, and it simply cannot wait. I have sent a letter to Minister Elliott asking for more pharmacies, especially in the community of Malton, to ensure everyone who needs a test can get one. It is my hope that the Minister of Health and the Premier will take priority communities like Malton into account when expanding the testing program. And now, I will invite Dr. Lowe to provide us with his weekly update. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 3,707 cases of COVID-19 in Mississauga. Of these, 287 are active, 3,189 have recovered, and 231 residents have passed away. Since Labor Day, we have kept our new daily cases on a slow, linear burn in Peel, and we are able, through our investigations, to determine the exposure source in 85 to 90% of the transmissions in our community. This means we're not quite seeing a second wave picture here in Peel yet, but the operative word is yet. It can happen here too, especially if we aren't careful. We must remain absolutely vigilant, especially as the overall provincial picture is trending towards a resurgence, and we continue to carefully monitor what is happening in our neighboring municipalities. It's up to all of us to keep this under control. Remember that COVID-19 spreads from person to person through close contact. This means that our interactions are crucial. Here in our region, Peel Health continues to trace a cycle between workplaces, homes, and social gatherings, and continues to make recommendations based on our data and our community picture. With cases rising around us and in Peel, I urge all residents to shrink your circles and bubbles, limit your close contact to your immediate household and essential supports. Beyond that, with any other interaction, practice the core 4 of distancing, masking, hand washing, and self-isolating and getting tested if you have symptoms of COVID-19. At home, remember that if you are sick or if you are returning to Canada, self-isolation means self-isolation. That means also isolating from your family at home. In workplaces, we have seen spread in settings where people cannot work from home and where a lack of precautions leads to crowded, close interactions. I urge employers to consider remote work as your primary means of operating. And if that's not possible, please keep your employees safe. Visit peelregion.ca/coronavirus and click on Businesses for information on precautions that you can take. And for everyone who is at work, remember that taking a break from work is not taking a break from precautions. Always stick to the core four, even if you're heading home or in the lunchroom with your coworkers. Finally, as Mayor Crombie has mentioned, social gatherings continue to drive transmission. We've seen the whole range. Certainly house parties have gotten lots of attention, but we've also seen transmission through coffee dates, Friday night dinners. Large organized gatherings have become a significant driver, especially weddings. In recent outbreaks, we've seen precautions at such gatherings go out the window. The joy of the event often results in unfettered close contact among many. In particular, the significance of weddings also means pressure to attend. We've investigated exposures where members of the wedding party have shown up symptomatic and later tested positive. I cannot stress this enough. Right now, less is more. Please keep your numbers, your proximity, and your duration low. Family dinners, backyard gatherings, weddings, prayer meetings. If you are sick, even a little, don't show up. Ensure that everyone who does show up sticks to precautions. And for large events, if you're a banquet hall or a venue, consider offering your patrons refunds or rescheduling to keep them safe. And if you're organizing a celebration, I ask you to reconsider. Look, it's fine to get married, but my thought is moving your celebration to sometime next year is the best way to keep your family, friends, and loved ones safe. Right now, the risk simply isn't worth it. I encourage you to let COVID move your wedding story rather than become part of it. As always, in our homes, our workplaces, and our social gatherings, each of us has a crucial role to play in living our lives while controlling spread and forestalling a second wave in our community. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. As home to Toronto Pearson Airport, Canada's largest and busiest airport, I would be remiss if I didn't take an opportunity to remind returning travelers of their responsibility to adhere to the mandatory quarantine. If you're coming home to Canada or visiting, you must isolate for 2 weeks. While it's inconvenient, it is not just necessary, it is your legal obligation. If you don't comply, you could face stiff fines up to $750,000 or worse, jail time. If you need a safe space to self-isolate, there are supports available to you. With the help of Dr. Lowe, we are submitting an application to the federal government for their support to fund a voluntary isolation center here in Peel that will help those who find it difficult or impossible to self-isolate because of crowded housing situations or simply find the cost of isolating outside of their home exorbitant. I look forward to following up with Minister Hajdu about this identified need in our community in the weeks to come. We want to see air travel resume and know that our partners at Toronto Pearson are working diligently to keep our airport healthy and safe. Once again, I thank them for their efforts. I also want to thank Peel Regional Police, who have been working closely with the Public Health Agency of Canada to help enforce the Federal Quarantine Act in our community. This is just one of the many ways the Peel Police have stepped up during COVID-19 to keep our community healthy and safe. From working with our bylaw teams to enforce gathering limits, to cracking down on street racing, all of these activities take a significant amount of their time and their resources. We can't allow our police force to get stretched too thin. We need to make sure that they continue to stay focused on tackling some of the big issues facing our community, including violent crime, guns and gangs, drugs, and human trafficking. I ask the province to consider these additional pressures facing the brave men and women of Peel Police when allocating resources in the fight against COVID-19. With that, I will now turn it over to Staff Superintendent Sean McKenna from Peel Regional Police to provide us with an update on how the police are assisting the federal government with implementing the quarantine orders. Sean?
Thank you very much, Madam Mayor. Since the beginning of the pandemic, the Peel Regional Police have played a role in conjunction with the Public Health Agency of Canada. To date, we've conducted over 872 checks of mandatory Federal Quarantine Act orders. On Monday, we received an additional 105 checks to do. This takes considerable resources. We are currently tracking the amount of time that this takes our officers and our civilian personnel, and to date, it's taken over 2,000 hours of Peel Police time. We understand that this is an essential role of the police to ensure public safety and to contribute to the well-being of our community. We will continue to work in concert with the City of Mississauga bylaw personnel to ensure that bylaws are adhered to. In addition to Federal Quarantine Act and bylaw investigations, we have issued over 120 tickets under the Emergency Measures and Civil Protection Act for breaches of provincial legislation. We continue to play our part in ensuring that the residents of this community remain safe and healthy. Madam Mayor.
Thank you, Sean, and thank you for all the work that Peel Regional Police have done day to day, but also particularly during the phase of the pandemic. I can't emphasize enough that it's going to take us all doing our part by staying apart and working together as Team Mississauga, our residents, our businesses, City of Mississauga Public Health, our paramedics, our police force, and our local hospitals, and more, to keep our city healthy and safe. And with that, I'm now happy to take questions along with Dr. Lowe and Staff Superintendent Sean McKenna.
Mayor Crombie, your first question comes from Isaac Callan from The Point. Isaac, please go ahead.
Hey, Mayor Crombie. I want to ask about the decision of both you and Dr. Lowe to mention the fact that Peel itself isn't yet in a second wave. I understand the logic that Dr. Lowe has explained. I think it must have some link towards Peel being a hotspot at the end of August and the start of September. But since you and the Premier and other people have said that people are getting lax about the rules, why bring this up at a press conference? Why tell people we're not yet in a second wave? Could that not encourage people to continue to be lax?
I'll start the response and then I'll pass it on to Dr. Lowe. I think for the most part, Isaac, our residents and our businesses have been compliant, especially with the businesses. We see more than 99% compliance. There have been 7 tickets issued this week, but for the most part, people are compliant and want to follow the rules and the guidelines. With an average of 28 cases in the past week, with Peel averaging 75 to 100, depending on how we're measuring, we are not in a second wave yet, and I'm very reluctant to close those very businesses that have kept our residents safe and our community safe. I'll now pass it off to Dr. Lowe to give his comments.
Yeah, thank you, Mayor Crombie. Thank you, Isaac, for the question. I'm a father of 2 daughters, and one thing that I've learned is that when they do something right, it's really important to make sure that you reinforce that and you make sure that you make it very clear. I absolutely agree with you, Isaac. There was a lot of questions and a lot of concerns around the numbers we were seeing in Peel, particularly around Labor Day with the school reopening looming. I think it's pretty clear, as Mayor Crombie has identified, that our cases have stayed in the range of 75 to 100, 70 to 100 over the last 3 weeks. Of course, with the various spikes that are owing to lab backlogs, certainly there was the spike of 130, but that followed a day of 60 and 40, and so certainly we're seeing the backlog impact some of our daily numbers. But on the whole, the average has stayed fairly well. And I think it really is a testament to our community coming together, recognizing the seriousness of this disease, and in a measure of positive reinforcement to say, listen, there's not a second wave yet, and it's up to all of us to keep it that way. Thank you very much for the question.
Can I keep you there, Dr. Lowe, please?
Sure, no problem.
Thank you. My follow-up is relating to the epidemiological reports.
Yes.
We know that you and the Premier and various other people have talked about more targeted interventions to avoid the economic shutdowns, and the categories for transmission that are available, at least publicly, are quite broad. Things like community, workplace, travel, rather than being banquet halls, gyms, weddings. Are you hoping that either you or the province can change those categories so that you can get much more granular data available for the public to see as well as yourself, so they understand at a glance where this is coming from?
Absolutely, Isaac. And so as I've said throughout this response, we're absolutely committed to sharing data that we're able to share, in summary and in aggregate. We are seeing transmission from workplaces to social settings to homes. And that has actually informed a lot of the restrictions and the interventions that we've been pushing for and advocating for. Homes, certainly with the isolation center, the reminder that I said today around self-isolation means self-isolation, that critical messaging getting out. Workplaces, certainly with the province recently hiring new labor inspectors, and we've been chatting with them. And if you'll look at our our race and occupation report, the high-risk sectors are identified in there, and so we've been talking with the Ministry of Labour about getting more proactive inspections done in those settings to make sure precautions are being adhered to. And certainly in terms of social gatherings, weddings, etc., to the extent that we're able to share, recognizing that these can often be quite identifying if we go into significant detail, I think the fact that I've spoken at length about weddings today and social gatherings overall really highlights just the broad nature of those events and how they all, if they are not carefully undertaken, act as a vehicle for transmission. But certainly I'll continue to make my remarks, and the data that we're able to share with the resources we have, certainly the aim is to get more EPIs on the public reporting front, but the focus of our epidemiologic team is actually in the response right now and directing what steps need to be taken at this time. We'll continue to work on that. Thank you, Isaac, for the question.
Dr. Lowe, we'll keep you up there. The next question's for you, followed by Mayor Crombie.
Okay, no worries.
Next question is from Steve from the Mississauga News. Steve, please go ahead.
Go ahead, Steve.
Thank you, Nicole. Hi, Dr. Lowe. How are you?
Good, thanks. You?
Good, thanks. So Peel's had around 15% of Ontario's cases today, and the potential, I guess, projection into next month, we could see around 1,000 daily cases according to what the province has put out today in the modeling. That would mean, I think if my math is correct, around 155 daily cases across Mississauga, Brampton, and Caledon if we do get to that 1,000 daily case mark. If Peel does get that kind of daily case rate, what kind of measures can residents and businesses expect to see to control the spread of the virus?
Well, Steve, I want to make very clear that I'm already recommending measures. This is not a case of standing around and waiting for it to get that bad. We are at a level where, we can case and contact manage all we want, and certainly the capacity we built since the spring has really supported our ongoing response. But there's also recognition that we need people to make sure that they are really shrinking their bubbles, limiting their exposure, their duration, their numbers and contacts in the course of their day-to-day activities. And so all the recommendations that I've made and the ones I made to Isaac are really those recommendations and targeted interventions that we're trying to do to forestall anything that might reach up there. So it's up to the community to adhere to them, it's up to the community to work with us, and we will continue to make recommendations as we see patterns of transmission in the community. Thanks for the question. I'll pass it back to the Mayor.
Hi, Steve.
Hi, Mayor Crombie. I guess I kind of pose the same question to you as well. I know that you've mentioned that Mississauga is not quite as bad as Brampton in terms of daily cases, but as you're aware, businesses and I'm sure residents are concerned about what kind of changes might be coming in terms of new requirements, potential shutdowns. So what would you say to folks that kind of waiting and trying to prepare for that kind of thing ahead of it.
My message is continue to be vigilant, continue to follow the guidelines, both from the Ministry of Labour and the Ministry of Health, and from Public Health, follow the core four from COVID, protect yourselves and your family. I'm very, very reluctant to consider any rollbacks at this point. We are in a good position. We're kind of at a cusp right now if things are good, and if we continue to be vigilant, things will remain as is and get better. I'm very, very hopeful. I'm not considering any business closures at this time. Things would have to be in a different position for us to consider doing so.
Mayor Crombie, your last question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Mayor Crombie, how are you?
Welcome, Khaled. Thank you for joining us.
My pleasure. First of all, let me commend the great work by Peer Police and the 2,000 hours and also 872 checks. My question would be, does every returning passengers going through our airports and who lives here in the Peel region receives follow-up checks like other regions or no?
So, Khaled, my understanding is that everyone is advised of their responsibility to quarantine that come back into the province, but I believe only those who are COVID are showing symptoms get the follow-up. Sean, is that something you want to respond to with respect to travelers coming back into Canada? I'm going to ask Staff Superintendent Sean McKenna, please, to respond.
Thank you.
Thanks very much for your question. So when we get the lists that come to us via CBSA and the Public Health Agency of Canada, we do in-person checks of every single person that is on that list. To date, we've done 872 in-person checks. During the course of their quarantine, we will contact them in person and ensure that they're in compliance. And just to make note, in regard to what Dr. Lowe touched on and the Mayor touched on earlier, one of the things that we're finding very encouraging is the level of compliance of individuals under quarantine. No, we don't have the ability to track them throughout the 14 days, but to date we have not found it necessary to lay any charges under the Federal Quarantine Act. Early in the pandemic, it was suggested that we play more of an educational role, but we are certainly going to look towards taking a measured approach to enforcement to ensure that everybody is safe. So, thank you. Madam Mayor?
Chief, if you please, how fast and how quick does the list being updated? Is it real time?
Well, one of the issues that we've been addressing with our federal partners is to get the list to us a little quicker. Earlier on in the pandemic, they were coming a little slower. We would get the lists, and some of the individuals maybe only had 7, to 3 or 4 days left under their quarantine, mandatory quarantine order. But we've, gotten some great assistance from our federal partners and found that we're getting the list much quicker, usually within 3 or 4 days. So we have 10 to 12 days at least to check on the individuals on that list.
Appreciate it.
Thank you.
Thank you. Mayor Crombie, two things.
Yes.
Where did you get your mask from?
Oh, yes. This is from the Como Foundation, and this is perfect for those who need to lip read, and that is part of the design, and I'm very, very proud of this mask. The Premier was present at the company who is manufacturing them, McRae of Mississauga, when was that? Monday. It was Monday, to help us launch these masks. Aren't they brilliant? And it certainly helps people lip read.
Great. And if you can ask them to put us on their list, please.
Absolutely, we will do that.
And one more thing. What does Dr. Lowe has promoting the ribbon on his suit today?
Oh, the ribbon. Oh, I'll ask Dr. Lowe. Oh, it might be Orange Shirt Day? Orange Shirt Day, which is to raise awareness of the Indigenous children that were forced to attend residential schools. So we've all had, if you check my Twitter, I raised awareness by posting a photograph as well. We discussed it at council, and those who can have worn an orange today in honor of Orange Shirt Day and Indigenous children at residential schools.
Really appreciate it. Thank you so much.
Thank you.
Thank you.
Mayor Crombie, there's no further questions. This concludes today's press conference. I thank everybody for participating on behalf of the mayor. Have a great day and stay well.
Thank you.